Hi, I'm Congressman Scott Peters, talking to you from San Diego. I wanted to check in with you about what Congress is doing to respond to the two crises we face from coronavirus. First is a healthcare emergency. We want to prevent people from dying. We want to support our healthcare workers. And second is we have to deal with the economic impacts from this to workers and businesses. So let's talk about the healthcare part first. And remember, above all, we want you to follow the directions of the healthcare professionals. Make sure that you have good hygiene and that you're not going to work and you're keeping your distance from people. First, Congress a few weeks ago passed a bill, $8.3 billion, just to equip the healthcare agencies in the federal government to deal with all the extra work that's going to come. So we were happy to do that. And then the second bill we did, the Families First bill, made sure that we wouldn't provide any incentives for people to do the wrong thing. So we want to make sure that if you qualified for a test, you don't have to pay any co-pays. If you're not covered, you get it covered. The other thing is we wanted to make sure that you felt comfortable not going to work, so we gave everybody 2 weeks paid sick leave that will be reimbursed to the employer by the federal government through payroll taxes. And then an extra 10 weeks of leave for family members if you have to take care of a child who's home from school that's closed, or if you yourself are still not feeling well. We want to make sure you do the right thing. And finally, we passed the CARES Act, which provide $100 billion for hospitals and healthcare providers, $1.32 billion for community health centers, helps reimburse Medicaid and Medicare, mental health programs. It provides $4.3 billion to states and local public agencies, and a $16 billion to replenish the national stockpile, because we got to get a lot of stuff like masks and ventilators and protective equipment to hospitals, make sure those frontline people are protected. My staff's ready to help you answer questions about anything, but on healthcare, we're certainly happy to answer your questions. We're at 858-455-5550, and be well.